We started this project back in around May or June time after Adam Lott's team, the Health Inequalities team, provided us with a health equity profile, which showed that our missed appointments rates were highest with our Black and ethnic minority groups and also in our families that come from most socially deprived areas. And so we wanted to investigate that a little bit more.
Once we'd got the data, the next steps involved working with Desiree from the engagement team and my colleague Beth from the school health team. Largely, there were parents with children who are neurodiverse. They felt that the advice wasn't suitable for them, and in some cases it made their behaviour worse. This resulted in parents disengaging with the service. Some parents reported that rather than tell the nurse that they didn't want a second appointment, it was easier for them just to ignore the phone call.
I think we thought that we would find that people maybe just forgot the appointments and maybe didn't really think too deeply into the people that maybe disengaged because they didn't find it useful. So that's been quite revealing, and I feel like it's actually quite a brave process to go through as a service, because you're almost asking your harshest critics how they find your service. So you have to put your brave face on and really take on board that constructive feedback.
We recognised in some areas we had particularly high rates of missed appointments. And we recognise that not only does that mean that a family or a child hasn't received our service, but it also then has an impact on our teams in terms of their productivity and needing to reschedule those appointments and following up families, etc. So in terms of the work that we've done, we've really tried to look at the locations and the way in which we deliver our services. We've also spent a lot of time talking to families about and to children about how can we make our services more accessible and encourage people to attend their appointments in the first instance. And we've introduced things like text reminders to ensure that families have the opportunity to be reminded of their appointment, and also looked at ways in which they can easily change their appointment if something comes up. We all know that families have busy lives and things can get in the way of attending appointments. This financial year to date, we know that we have avoided approximately 7,000 appointments being missed by children and their families this year alone. And what that means in real terms is that we have been able to see those children, we've been able to work with their families to think about, are there any areas of support that they may need, and then arrange for that support to be put in place for them.